Hi, so you probably just recently passed the board exams. Now a decision has to be made whether you do moonlighting or you start residency training. So I am Dr. Glenda Manayan. I am a level 2 resident here at a private institution in Cebu City. So the internal medicine program, just like any other programs, you have a hospital of choice, you submit your application, they like you get invited for an interview, and then you get invited for a pre-residency period. So the pre-residency period, depending on your institution, is usually a month long. It could be a paid or unpaid status. So just depending on it. Basically, during pre-residency, you do observations, you do shadowing with the resident doctors that are on duty. So internal medicine is a 3-year long program. So you have first year, second year, and third year, or level 1, 2, 3. Level 1 residents are in charge mostly of the wards, patient care, doing updates, doing rounds with the consultants, and doing ward works. When you advance to level 2, now you're in charge of the emergency room. So at the emergency room, you admit patients, you manage them. We mostly urgent patients or emergent patients. Also, you could be doing a subspecialty rotation wherein it's divided into 3 bundles. You have the cardiology bundle, you have the infectious disease bundle, and you could have the pulmonology bundle. And once you advance, now you become a third year. So now you're in charge of the ICCU. So because of this COVID pandemic, the PCP, or the Philippine College of Physicians, is the governing body of all training institutions in medicine. And when we have a patient that's COVID positive, we usually stratify them based on the severity. If they're mild or moderate, the first years are usually the one handling them. But when the patients succumb to severe or critical disease, it's now going to be passed on to the seniors, level 2 and level 3. Because of the COVID pandemic, also, most resident programs, you are employed on a contractual basis. So you don't really get the perks of a regular employee, especially health insurance. So you don't get health insurance. So to protect yourself, you need to buy your own health insurance basically, and you need to have PhilHealth. But that's a requirement anyways in any institution you apply for. If you have any questions, if you need clarifications of things, please shoot me a comment and subscribe.